Hello, everybody, and welcome back for part three of uh, our Medicare For All series, which is an attempt to solve the problem of inadequate medical insurance and medical payment bankruptcies and medical debt that plagues quite a few Americans these days. So, for this final video in the series, I wanted to start out by briefly talking about the difference between socialized medicine and socialized medical insurance. Um, a lot of times you hear people who object to Medicare for All saying, oh, socialized medicine, socialism. And as I've already pointed out in earlier videos, about a third of all medical care right now is through socialized insurance programs. So it's not like this is a brand new thing for America. The government insurance programs like Medicaid and Medicare pay for about a third of all medical care right now as we speak in the United States. So we already have a partially socialized insurance system, but for 2/3 of medical expenses, people who aren't covered by Medicaid or Medicare, we have a more privatized system. So we've got this kind of mishmash. And um, so we can ask, why is it important to socialize medical insurance? But first, let's really focus on the difference between socialized medicine and socialized insurance. Insurance just involves who pays for things and how those payments are done. Whereas socialized medicine is where the government actually runs the training of healthcare personnel, doctors and nurses are trained in government facilities, and the government runs the hospitals. So hospitals where doctors and nurses work are government facilities. That kind of socialized medicine does exist, mostly in places like Russia, or China, in what we would consider authoritarian, oligarchical, or communist countries, though they're not truly communist. The Western nations, though, that have socialized insurance do not tend to actually have socialized medicine in that sense. And certainly in this country, I'm not advocating, and I don't really know anyone who is advocating for converting our system to actually socialized medicine, where the government runs the hospitals and owns the hospitals, and the government runs the medical schools and owns the medical schools. I don't hear anybody advocating for that, and I'm certainly not. In a socialized medical insurance scheme, in a Medicare for All scheme, the hospitals could still be private. The medical schools would still be run by, universities or private institutions, as well as nursing training schools. So none of that would change under a socialized medical insurance or Medicare for All system. So you might ask, why do we need a socialized medical insurance system? And the answer is severalfold. One is the current system leads to a lot of financial hardship for people who do not have adequate insurance, either because they're not covered at work, or they can't afford the premium burdens that are placed upon them. The system is difficult and can lead to bankruptcies. Medical debt is actually a leading cause of bankruptcy in the United States. So a lot of people go bankrupt or have very burdensome debt loads from uncovered medical payments if they have inadequate insurance. And these days in the private sector, a lot of businesses are not covering insurance premiums the way they did once upon a time. So a lot of the cost burden, if you're not in one of the government programs or you don't have good work-related insurance, a lot of that cost burden is shifted to individuals who, basically are just one serious illness or injury away from bankruptcy given the cost of medical care these days. So one reason to switch to socialized insurance is it takes away that burden and it evens out the burden. So you don't have this huge disparity between people with really good insurance and people with no insurance and their outcomes should they need medical care. Also, by socializing the entire system, you can really get into some huge cost savings. Our system is very expensive. We spend a lot for what we get. In a lot of other countries, their medical outcomes are actually better than ours. They live longer. Their illnesses tend to be better managed. There's less death around childbirth, and yet they pay less per person for medical care. And a big part of that is that they have socialized insurance programs. So the government essentially negotiates on everybody's behalf over costs and basically forces hospitals and doctors to, accept reasonable payments and not outsized payments. Under the current system, hospitals, doctors tend to, they bill a lot, and what they get back depends on what kind of insurance the person has. But the reason they bill a lot is because they know that, for some people they're going to get some amount, for other people they get more, for some people they won't get anything because the people aren't going to be able to pay. So, they sort of ask high and settle for something in the middle. But in a socialized insurance program, the government can negotiate drug prices, can negotiate costs for tests, for visits, for hospital stays, for procedures. And because the government's essentially negotiating on everyone's behalf, it forces the hospitals essentially and the doctors to, take a more reasonable payout. And it brings the cost down for the system, generally too with better outcomes, at least if we go by what other countries are doing. So there's a lot of real upside to a socialized medical insurance program. People don't have to worry about going bankrupt over, their medical bills, and the entire system costs go down. Now, again, we did cover the fact that, there can be a downside in the sense of if everybody has decent insurance under the system, presumably more people will seek more medical care. And, as it stands, we don't have enough doctors and nurses to care for everybody. There's been bottlenecks in training, and people have left the field because it's, become kind of frustrating and difficult. So, you do have the chance of implementing a system where you just don't have enough providers, and then you have to do some triaging on the care. So what that means is, like in Canada, for example, if you need emergency service, if you're acutely ill, you'll get seen right away. But if you want to do something that doesn't seem really that like an emergency, you may have to wait quite a while, sometimes months, many months, to get seen. And so that's just a way of, rationing care when there just aren't enough providers to provide all the care that people want. And that's certainly a possibility with the system, at least in the short run, until the training programs can ramp up. So what about the details of providing Medicare for All? How would that work? Well, as we mentioned in previous videos, it's going to be expensive. Not as expensive as the current system, but if the cost burden shifts pretty much mostly or almost wholly to government, then government's going to need more revenue to cover this. So tax burdens are going to go up. Got to pay more taxes. And in countries where they do have socialized insurance, taxes are higher than they are generally in the United States. There are different ways of doing that. Right now we do pay a small Medicare tax. That would have to expand significantly So from the 2% or so of gross income that people pay now, would have to go up quite a bit, probably between 10 and 20% of gross income to really get coverage. And probably businesses would also have to pay some percentage like that of their payroll in order to implement a true Medicare for All system. So basically, individuals and businesses would get hit with, let's say, 15 or 20% off the top gross tax for coverage. Also, we probably have to restructure some of the way that government takes in revenue to increase government revenue generally. One way to do that would be to tax capital gains as regular income, although you could give capital gains its own separate deductible so that people who just have small investments wouldn't be hurt by that. And another way, too, is to restructure the way we do corporate taxes. So as it is now, there's a lot of incentive to sort of cheat and hide in corporate tax rates because we tax corporations based on domestic profits, which is pretty hard to gauge under any circumstances. But maybe a better way to do that is to, instead of taxing based on profits, you tax based on revenue. So gross revenue, which all businesses are required to report. And you can also, for like a foreign business, for example, that's not required to report all the revenue to us, we just tax them based on their sales into the United States. So, for example, if there's a Chinese corporation that sells, let's say, $1 billion of stuff to the U.S. every year, then we tax them based on the $1 billion that they sell to us, not based on the other revenues that they sell to folks in other countries or in China. And it really doesn't matter in that case if companies try to use shell companies, because you're going to tax whatever company is the final sales point into, so if a Chinese company sets up a subsidiary that's in, somewhere, another country that's in Ireland, and the subsidiary sells to the United States, then we still bill for gross sales the subsidiary. So, it doesn't really matter. Also what would be billed is transfers into the U.S., financial transfers in the U.S., and profits earned from investments in the U.S. So all those things would be considered revenue and would get taxed. And I think that taxing system, people will complain about it, particularly businesses, because they'd say, well, you're taxing us and we're losing money. But it would be a smaller percentage. The tax would be a smaller percentage than the current tax on their profits. So, for example, if we were to tax a corporate profit at 20%, the tax on sales would be a lot less than that. Maybe, 4%. And that should preserve healthy profit margins. I mean, if a company has to pay 4% off the top of their gross, but they still can't make a profit, then they're not doing business very well. So anyway, those are some ways we can implement. As far as the implementation of, putting people on it, everyone would go onto the system. Now you could argue about things like how to set up the system. Do you set it up with co-pays, for example? Like standard Medicare only pays 80% of bills, which still leaves 20%, which can be quite a lot if you've got a high bill. So ways to deal with that, some people ask, well, what about all these private companies that offer insurance? Are they going to just disappear? And one thing that they could do, for example, is they could become they could sell gap insurance. So if the standard Medicare were still like an 80% cost coverage, then the private insurers could go in and cover the other 20. They could sell policies with monthly premiums just to cover the 20% of costs that Medicare doesn't, and those premiums would be a lot lower than standard health premiums because they'd just be covering a fraction of what the actual bills were. Also, you could and probably should implement some copays for people for procedures, and maybe also a monthly charge, depending on things like age, for example, for just the standard Medicare, like there is now. I mean, there is, for people who can afford it, there's a standard charge for Medicare monthly. And you can buy, paying extra, you could get the Advantage plans that cover the gaps. So we could do that and just have the private insurers switch over to gap coverage. So they'd all be essentially in gap coverage. And these would be ways of implementing this so that there would be sufficient revenue and there wouldn't be major disruptions economically. Again, the ultimate goal here, and it would be realized, would be cost savings. Current Medicare and Medicaid too have tremendous cost savings over private insurance, both for the patients and for the system. So no reason to think that a Medicare for All would not. It would actually be better, as it would have higher economies of scale. That is, with more coverage of more people, there'd be more negotiating power for the government, and they could control the costs in the system much better. So anyway, those are my ideas. The difference, we again realize that this is socialized insurance, not socialized medicine. There's good reasons to do it because the current system is not working well for us and is causing high bankruptcies and high costs without good outcomes medically. And there are ways in the details to both pay for it and implement it in sound and reasonable ways. Okay, so hope that some of this was clarifying for you, and I will be back with a new series on, I think my next series will probably be on education, since that's the field I come from and have some expertise in. All right, so thanks for joining, and I'll see you soon.